Let's Talk Chiropractic. And for those of our regular viewers, you've probably figured out by now, I am not Rick Marticelli. I'm Liz Tolan. I'm joined here today by Dr. John Degenhart. Hello, Dr. John.
Hi, Liz.
Dr. Stacy Sando. Hello.
Hi, Liz.
And two of my favorite people, Jen and Sarah, both massage therapists here at Degenhart Chiropractic. And we are going to talk today about massage therapy, Dr. John.
Yep. We first want to let everybody know, and the viewers, that our good friend Rick Marticelli, we did this show for probably 12 years together, but for personal reasons, he's no longer able to do the show. So I miss him, I love him, but Liz is a pretty good substitute. She's pretty attractive here, Rick. So good luck with your new endeavors, buddy.
Well, we may as well get right into this now. Today, we are going to talk about the benefits of massage therapy. We're going to tell our viewers a little bit about the different types of therapies that they can get. And stay with us, because right after the break, we're going to give you some examples. Let's Talk Chiropractic right here. Stay tuned. Hello and welcome back to Let's Talk Chiropractic. Today's show is all about massage therapy. And Dr. John, we're going to be looking at a couple of different types of massage therapy today. And Sarah, I believe the first one we're going to be going is we're going to take a peek into the massage room and we're going to see a normal massage. Now, Dr. John, we were talking earlier about how we want to let people know kind of what they can expect to take away some of that anxiety or the uncertainness that would go along with someone who's not familiar.
I think there's many people out there who want to get a massage, but they're not really sure what it's all about. So let's talk to the two different girls. We're going to actually look in their rooms and see what it's all about.
See what it all is about and take a little bit of the anxiety out of it. And then people can get an idea of what different treatments are available and which one might be best suited for them. All right, let's go take a look.
Okay.
And we have Lisa with us, and Lisa is getting a massage.
Yes,
She's
she
very lucky today. What type of massage will you be doing
I will
for
be
Lisa?
doing a regular massage today.
Okay.
Okay? And we already have her draped, and she's comfortable.
She looks very comfortable.
Yes, she is.
Very comfortable.
So we're going to start, and the first thing I do is feel out, and she already told me what her problem areas are, and they're up in here and down below.
Okay.
Okay? And what I like to do is to assess and see if there's some tightness going on. So that's what I'm going to do. And I like to talk to the patient. Is everything feeling okay?
Yes.
Okay. And are you still comfortable? And we like to make sure that the patient is still warm. Are you still warm?
Yes.
Good.
Now you said this is a normal massage. Can you tell me, when you say a normal massage or a regular massage, what does that mean?
It is actually called a Swedish massage.
Okay.
And it's different movements and techniques that we do.
Okay.
And every massage therapist knows how to do this massage. So basically, it's relaxing and more for, it's more for normal. Like, of course, when you come in, we see how you're doing to make sure that you're healthy enough. So basically, what we do is we like to relax the body, reduce stress with this.
I see.
So, and then what we do is we use oil, cream, lotion. Everybody uses something different.
Something different. And you know, Sarah, when I come here, I actually bring my own aromatherapy.
You are allowed to do
patients
that.
can
You
bring their
are
own
allowed to
oil
do that.
as
Yes,
well.
you are. Yes,
And
you
even
are.
with music, this evening or today we don't have music going, but I know I see you've got a CD player there, and we can patients can request some music to soothe them, or
Yes.
they can bring their own.
Yes, yes. Some people like classical. Some people like Enya. Some people just like water. You know, some people can't relax when there's singing going on. So we like to talk to the patient to see what they like.
And what's going to make them comfortable, because
Yes.
this is really their time, isn't it?
Yes, exactly. It's tailored to their needs, and that's what we love to do here.
So right now, you're just trying to find what areas might be tight
Yes, yes.
for Lisa?
Yes. So up in here, I feel that there's tightness. So I'll begin to relax, and like I said, we do different strokes, effleurage, petrissage. Is that okay, the pressure?
Yes.
Okay.
And I noticed you just asked the patient if the pressure is okay, and I guess, again, you want to make sure they're comfortable. There shouldn't be any pain during this.
No.
Hey, Sarah.
No, and we always ask that the patient tells us. I always say, this is what I always say, I said, I don't want to hurt you, you know, and you're not going to hurt my feelings by saying it's a little too deep. So we may think, oh, this pressure is great, but they're not.
But you
liking
can't
it.
feel what's going on.
Yes.
So it's important to have a relationship with your massage therapist and to keep those communication
Yes.
lines open between the therapist and the patient.
And we're not going to get hurt feelings. Sometimes we like to watch, like sometimes if it's too deep, a patient will do that. But some are very well at holding that.
But you're looking for nonverbal communication as well. And
Yes.
you're really attuned to
And
what's going on.
And breathing as well. You know, sometimes people are nervous. Of course people are nervous. They're coming out of their comfort zone. Like right now, I have her back open. I have, you know, some people are very nervous and we want them to talk to us and everything. And another thing is sometimes they don't want to take their clothes off. We can work through the clothes. People don't always have to take just comfortable like sweatpants and a light shirt. Sometimes a tank top. They could actually keep their bra on. You know, a lot of people don't know that.
So you want the patient to be comfortable, and comfort means different things to different people. So I guess what we're trying to let patients and future patients know is that it's really all about whatever is making you comfortable, as far as how much you disrobe. And I see that here, Lisa, is you have a tuck going on here with the sheet, so she's still maintaining her modesty, and she looks very comfortable. I'm envious, actually, at how comfortable she looks right now, Sarah.
Yes. Yes.
So this is a normal massage, and it's for patients that might not necessarily have a medical problem, but are looking for relaxation, de-stressing, and really just wellness, because it's important to maintain our wellness, and massages are really quite therapeutic, aren't they? Even a normal massage is very good for the person, both physically and emotionally.
Well, like how we say, we just want to make sure she's relaxed. Once we get the body to relax, we're also increasing circulation. We're reducing muscle spasms. We are working with the lymph system, which is the body's natural defense system. So there's many things going on. And you don't know that because you're relaxing. So
you're doing all the work.
Yes.
So what we've seen here, it's a normal massage. It's for relaxation. It's for wellness, and it's for maintenance as well, to keep the body running smoothly. And also, I guess you would detect if there are any problems or any muscle spasms or anything like that going on. This is a good time to detect them as well.
And there's some times that it's, you know, you're working and sometimes you feel it underneath you, you know, and there's times that there's patients that, you know, like how I say, that they're in a lot of pain, and to get them to discomfort, and sometimes, you know, it spasms, and it's just...
And I guess sometimes it will take a number of treatments to get to the patient to where they need to be, to where they can get the full benefit of the massage. We're running out of time with this. Just very quickly, with this type of massage as well, I assume you would work on the whole body.
Yes, we do the whole body, full body.
Full body
massage.
massage.
If they would want upper, if they're having more issues with upper, we could just do upper. It's what they need.
It's all about the patient.
And when we take their intake form and they're healthy, you're good to go, and that's what we try to do here.
Super. Well, Sarah, thank you very much for showing us what a normal massage is. Lisa, thank you, and we will let you be now and let you enjoy your time. Well, Sarah, that was very, very interesting and informative. And one thing that strikes me about that massage, it seemed very relaxed.
Yes.
It seemed like your patient was in a very good place. And there's a lot of different things that you can do to cater to that patient and their needs.
Yes, and everybody's different, and that's what we like to do here.
And so that massage can be done either with clothing on or disrobed, and they can have music or not music, or oil or lotion. So you really get to know your patient, both what their likes and dislikes are, and also kind of their bodies and what their bodies need. And then you just...
Yeah, it's feedback, and that's the best way to learn, is they talk to us, we talk to them, back and forth.
It's a relationship.
Yes.
And I guess with that relationship, too, comes a level of trust. Once a client sees you maybe a few times, they get a little bit more comfortable. Then, as we were saying in the massage room, you can go a little bit further with the massage, and they get an additional benefit each time they come.
Yes, and not everybody don't like to talk during their massage, and that's fine. It's
I don't
their
like to
time.
talk during my
It's their time.
And that's what I like about the massage, that it's my time. And that's a very good point. You know, it really is all about the patient and whatever it's going to do to make them feel comfortable, and so that they can get what they need out of the treatment. Thank you for letting us watch and explaining that to us. And now, Jen, when we come back after the break, you're going to do a much different type of massage.
Right. I'm going to do cupping.
Cupping, which I found fascinating because I've never seen it before.
Yeah, it'd be interesting to see and, you know, talk about how it works.
So in a minute, we're going to be joined after the break. We're going to go into the massage room with Jen, and we're going to look at a cupping massage. Stay right here. Let's Talk Chiropractic, only on WYLN. Hello and welcome back to Let's Talk Chiropractic. Today's show is all about massage therapy. We're giving our viewers a good idea of a couple of different types of treatment that we could use to help us feel better and stay better. We're joined here today with Dr. John Degenhart, Dr. Stacy Sando, and we've got Jen and Sarah with us as well. Now, Jen, it's your turn, and you're going to tell us about cupping massage.
Right, right. Cupping is a great way to help to relax the muscles because it will help to bring a lot of the inflammation to the surface area. So that helps with release the fascia or the connective tissue area. It also brings the blood flow up into that area, which will help with your vascular system. So you do get a really good detox from that.
Wow. Well, we're going to go into the massage room and we're going to take a look.
Thanks.
Now, Jen, you're going to show us an example of what a cupping massage is.
Right. Right. What cupping is actually an old ancient art that started back during the Empire days, and they originally started using horns to light it up to help to seal to the skin. And what they was doing with that was to help with like any type of wounds or any type of insect infections to help draw out any of the infections that were going on. But in today's world, we use the plastic cups, and they come in different sizes. This is a large one, and then it goes down to a small one like this. We also have magnets that are also with this. And I'll just show you how it works.
Jen, let me ask you a quick question here. With the cupping massage, how do you determine if a patient, like Kayla's here, she's getting a cupping massage, how do you determine that that's the right massage for her? Or how would a patient know if they wanted to get a cupping massage instead of a normal massage or one of the other massages we're talking about?
Well, cupping is really great for any type of inflammation. This helps with the vascular system, and it also helps draw any type of inflammation you may have, any toxins that may be in there, any type of excess fluids that are in there. Because what this does is that it actually will pull the derma up into the cups, which will help bring the circulation up in there, which also helps promote the healing with the blood flow.
So this is almost like a detoxifying type of a massage.
Yes.
Super.
Yes, exactly.
All right, well, show us. And you have magnets?
Right, right. There's magnet therapy that is also optional with the set that we have. There's a positive and negative charge. And what this does
Does this hurt, Jen?
No, it really doesn't. It almost feels like a vacuum. You know how you put your hand into a vacuum?
So it's not a suction.
Right.
But
exactly.
no pain.
No.
And again, as we were saying earlier, any kind of pain, there should not be any kind of pain or discomfort. And I guess that comes with the relationship between the massage therapist and the patient. You're always keeping that communication open.
Right, exactly.
So Kayla should tell us if she's experiencing any discomfort during the treatment,
that's right? And they come in different sizes. So usually we use the bigger ones on a broader area. So what I'm going to do is just apply one up here. And this is a vacuum seal. This is a syringe that helps pull the derma up into the skin area.
And look at that. Her skin is actually coming up now.
Right.
And this does not hurt her. She looks very calm. She doesn't look like she's having any discomfort.
And we're going to put one over on this side.
Oh, and you leave them on.
Right. We leave this on.
Wow.
Because you can see what happens is that the blood starts coming up into this area.
Yes.
And with the magnets, because of the connection to it, they're working off each other because it is a positive and a negative charge.
Okay.
And then we just continue with putting different cups on. Like I said, we have different sizes. Usually what I try to do is stay opposites with the positive and negative. So I'll have the red in one area, and then we'll do the opposite with the blue.
How long would these cups stay on, Jen?
It really varies. You do have to keep an eye on the discoloration. Now, this can cause a little bit of bruising because it is a blood flow that's coming up into that surface area.
I see that. I can see her derma is changing